Thank you. It's a pleasure to be here today, and I want to recognize Amelia, Maimuna, and Maria Soledad for your comments earlier today, really talking about cities, how unprepared they are, the inequities that exist, and how we must push this forward in today's COVID pandemic and really capitalize on some opportunities here today. So thank you. And of course, thank you to the mighty Victor for continuing to get the world together on these important issues. And New York City has been one of the original signatories, as well as Sao Paulo, to the Global Compact. So we want people to continue to sign on. As you mentioned, I will try to be as brief as possible and give you things in a New York minute, because I know we're running out of time. We are the epicenter in America. We have over 15,000 deaths that are happening. We are a city of 8 million, with close to 1 million of those people with disabilities. And we are having issues. We're having issues on food supplies. We have set up 400 sites for people to pick up food, but some people with disabilities are not able to get there, or they have compromised immune systems. So we set up lots of resources to deliver food to people with disabilities throughout the city. You can find out this information by going to nyc.gov/getfood. People can call or text 311. They can check out our website. So there's lots of ways for us to be able to get food to people with disabilities that need it. We do see some problems here and there, but when we hear about them, we correct them rather quickly. Another issue that we have, healthcare workers, personal care attendants that work with people with disabilities to ensure that they have independent life. And there are city's direct workers in long-term care settings and are crucial and are essential workers who are caring for the most vulnerable. And we have to make sure that these workers have what they need, because if they don't, people with disabilities will flood the hospitals, and we don't want that. So we have worked with our service providers and independent living centers within New York City and healthcare providers to deliver protective equipment, making sure they have masks, gloves, face shields. And we continue to do that because we want to ensure that people with disabilities can live the most independent life and not get sick and flood those hospitals. We are conducting outreach because we know it's important to reach out to the disabled community. We'd like to think we know it all, but we don't. So we have a check-in with disability advocates and partners every week, and which is a 1 p.m. call on Fridays. So if you happen to be in New York, please let us know. We'd love to have you on the call. And we make sure it's accessible with captioning in American Sign Language, so we can provide the community with the latest updates on COVID-19 and what New York City is doing. And we have people from all over different city agencies to ensure that we continue to get the latest information. We have disability service facilitators in agencies across the city, which are contacts that work in each agency. And we provide them with the updates and what they're hearing in the community, so we can coordinate efforts within city government to make sure that happens. We have also, as a result of the conversations we've had, we've launched a disability-specific website for COVID-19, 4 resources available, and you could find that at nyc.gov/disability-coronavirus. And there are resources on food delivery, updates on city's resources, and multiple lines of contacts to our office for people that need assistance. And we know that people are worried about facing discrimination and harassment during this pandemic. Access to care, will care be rationed? We don't want those things to happen. We want healthcare providers to really think that they're looking at the person and not the disability. So if people do feel discriminated against, they can certainly reach out to our Commission on Human Rights. We're working across our state human rights to make sure that people with disabilities are represented in this pandemic and can get the care that they deserve. And for people that aren't able to leave their home, we certainly want them to have the support. And the last thing I'll leave is home activities. We want to make sure that people have home activities, have access to virtual events, museums, tours, workouts, performances, and podcasts. And one last thing is our Department of Education has remote learning, and we make sure that everything is accessible on accessible digital formats, but also for kids and families that don't have the resource, such as iPads and internet connection. The city of New York is providing that so they can get the proper education that they need to be able to do. And when we have an accessible virtual meetings, we make sure that they're accessible, and we put out digital guidelines for that, which I will send out in a chat right now. I want to thank everybody for your time, and I hope that was a good New York City minute.